What is the global burden of chronic bronchitis? Chronic bronchitis is a common condition that falls under the umbrella of chronic obstructive pulmonary disease, often referred to as COPD. It is marked by inflammation and irritation of the bronchial tubes, leading to a persistent cough and difficulty breathing. To understand the global burden of chronic bronchitis, we need to look at its prevalence, impact, and the factors contributing to it. Chronic bronchitis is defined by a chronic cough that produces mucus for at least 3 months into consecutive years, without any other underlying causes. The primary risk factors include smoking, exposure to air pollution, and certain occupational hazards. These factors contribute significantly to the global burden of this condition. Globally, COPD, which includes chronic bronchitis, affects around 4% of the population. This means that hundreds of millions of people are living with this disease. As populations age and life expectancy increases, the prevalence is expected to rise even further. Chronic bronchitis is a leading cause of death worldwide, responsible for millions of fatalities each year. Unfortunately, many cases go undiagnosed, especially in low- and middle-income countries where healthcare resources may be limited. This underdiagnosis can delay treatment and lead to more severe health issues. The economic impact of chronic bronchitis and COPD is substantial. It places a heavy burden on healthcare systems, with significant direct and indirect costs. In regions like the European Union, COPD accounts for a large portion of the total costs associated with respiratory diseases. Demographically, the prevalence of chronic bronchitis varies by region and age. It is more common in older adults and in areas with higher levels of air pollution. This highlights the importance of addressing environmental factors to reduce the burden of this condition. Preventing chronic bronchitis involves avoiding smoking and minimizing exposure to air pollutants. Management strategies include medications, pulmonary rehabilitation, and lifestyle changes to improve symptoms and quality of life. Public health initiatives aimed at reducing smoking rates and improving air quality can help lessen the burden of chronic bronchitis. Additionally, enhancing diagnostic capabilities and raising awareness among healthcare providers can lead to earlier detection and better management of the disease. International collaboration is essential in tackling the global burden of chronic bronchitis and COPD, particularly in regions with limited resources. By working together, we can make strides in reducing the impact of this condition on individuals and healthcare systems worldwide.